All right. Can you hear me now? I've just connected the microphone. Any luck? Let me put headphones and I'll. Yes. Okay. Great. Wonderful. Put the headphones back. Great. Okay. Thank you. Sorry about the technical mishap, but let's get started. So I'm going to start off answering the questions from the main article, and then depending on time, I might move on to the discussion questions from the second set of articles. So starting off with the questions from the main article. So on page 6, the aspects of effects on autonomy due to a device that predicts seizures are explored. The analysis says that the patient reports feeling more control after the device. However, there's an underlying trade-off. This is that this increased control comes at the cost of relying on an external thing for help. While the author addresses this in the section on over-reliance and safety risks, my question is whether reliance on any external entity always implies a reducing effect on autonomy. Yeah, great question. So we talked a little bit about autonomy when we talked about self-driving cars. So if you recall, autonomy, the auto means self, and nomos means like law or rule. So you're sort of giving yourself laws or giving yourself rules, or you're sort of in charge of yourself. And so the initial thought is sort of, I don't know, maybe any external thing, any sort of reliance on external things is sort of less autonomy. Why? Because, well, autonomy is self, and external things are not self. So you might have this initial thought that, yeah, any sort of external stuff is going to be a limit on my autonomy. There are sort of reasons to walk back from that sort of very strong position. The main reason is that it's impossible to live without relying on external stuff sort of constantly. So I rely on my water to live. I'm relying on my laptop and my microphone to talk to you and things like this. And I don't know, do we want to say I'm less autonomous because I'm doing these things with external devices? I don't know. That maybe not. It seems like maybe that's too strong. Maybe we want to say, oh no, I'm perfectly autonomous even though I have to drink water and I have to use a computer. It's only certain kinds of reliance on certain sorts of external things that make me less autonomous. But then the question is, where do we draw the line and stuff like that? So a lot of the secondary articles talk about this. They talk about different ways of conceiving autonomy. I think Gilbert talks about ways of conceiving autonomy. So I guess this was page 6. And I think there's just not easy answers here. Like this is just a good discussion question because you could have different understandings of autonomy. So Gilbert's talking about autonomy over here. He says the idea of intention, competence, absence of external controlling influences, absence of internal controlling influences. So the thought is maybe external stuff is okay if they don't control you, but if they just help you. Yeah, so no easy answers here, but you can sort of go in lots of directions. You can say yes, you can say no, you can say to some degree, things like that. And for anybody watching in real time right now, feel free to ask questions in chat whenever you'd like, and I can answer those too. Question number 2. It is sufficiently evident that the postoperative experience of a patient with the implant is one of the first-hand. There can only be so much research and statistics formed to generalize such an experience. There is no fixed way of dealing with severe neurological conditions. It has not been made specific here on page 4. Other common neurological and psychiatric conditions, which conditions and brain implants will expand into treating. Without the presence of a human prescription, a computerized protocol for an unpredictable human experience might be completely unsuitable for one of the many persons being implanted. How might this be dealt with if we cannot have a generalized guide for the postoperative experience of having a brain implant and no single way of treating a neurological condition or single medicine which suits all? Yeah, so I think in a lot of ways this is like a practical question. So the question is, you know, how would we use these implants for various neurological conditions in various circumstances for various people? Everybody's different and things like this. And so it's a practical question, and as the question points out, there's lots and lots of factors here, and so I think the answer is probably going to be sort of very granular or specific. So, for each particular patient, the answer is going to look different. A lot of the secondary articles, and I think the Gilbert article too, talks about sort of having to do this on a case-by-case basis with patients. Of course, that will be less efficient and things like this, but a lot of sort of medical treatment has to happen on a case-by-case basis. Doctors have to calculate sort of how much anesthesia to give you or what kind of medicine to give you. Some people are allergic to certain medicines, things like this. So, oh, the chat disappeared. So I think, yeah, I mean, that will be a difficult question, especially for medical practitioners, but yeah, I'm not sure there's much more to say about it specifically. One direction to go with this question could be, well, could this be a reason to worry at all about brain implants, ethically speaking? Like, is this an important challenge ethically, or is it just kind of like a practical challenge for medical people? If we accept that someone with the implant that medicates them automatically has the option to disable it, would they ever disable it? Or would living with this device, even when it isn't working perfectly, be preferable to living with whatever condition they have? And would it be ethical to present this as a permanent solution, considering it would increase the quality of life, but may affect the overall life expectancy, considering the difference in dosing? Yeah, so this first question, number one, of course, that seems like it'll depend on the individual person. So some people would disable it, some people wouldn't, maybe not. Also, this is sort of an empirical question, so to figure this out, we'd go and do research, and so not really our job in class to answer this sort of thing. Would living with this device be preferable? Again, that's sort of up to each individual person. Like, you'd have to study the people and find out, do they prefer living with the device versus living the condition or not? And then you'll probably get various answers, things like this. And here we have sort of a question more centrally focused on our class, so an ethical question, life expectancy versus difference in dosing. I think in a lot of cases we sort of let people make these decisions. So we have a medicine where it'll increase your quality of life but decrease the length of your life. Do you take the medicine or do you not take it? Go ahead, like, it's your choice to take it or not. This is one of the sort of reasons we care about autonomy so much. We usually think that if somebody makes an autonomous choice, then that's sort of the best way for things to go. Like, people should be able to decide how to live their lives. So this is a choice, sort of ethically speaking, that we leave up to people. Automated predictive therapeutic devices claim to control certain behaviors and give a sense of autonomy. In simple terms, the device gets to make decisions on your behalf. However, it seems that getting control of the brain doesn't guarantee that the individual retains individuality and the ability to make decisions. Does this technology hence validate the claim, to one who has consented, no wrong has been done? Yeah, so I mean, that's one of the central questions, which is, well, here's two questions. One question is, if someone consents to get the device, does that make it ethical to give them the device? A second question is sort of what kind of consent matters when it comes to these devices. So one of the secondary articles, or at least I think more than one, but one of the secondary articles talks about this idea of broad consent. So maybe we'll get there if the Q&A gets to the secondary articles. But if you think about just the sort of narrow consent, which is consent to get the device or not, you can consent to the brain surgery to get the thing in your head. But then after you get the device, there's the question, well, can you consent to using the device in the future? Can you, like, is there consent? If it's automatic, if it's just dosing you without asking, then sort of it's not going to ask your consent before it gives you medicine. You might think, oh, well, you didn't turn off the device, so you consented to use the device in that way. That's if you have the option to turn off the device, so that might be a reason to give the device an on-off switch rather than just put in a device that the person can't control. They have to go to the doctor to get it turned off or something. So this question sort of, like, this idea of consent and autonomy, because we like consent is something that you do with your autonomy, sort of leads us to think, oh, so maybe this is a reason to give people the option to turn it off themselves, or maybe it's not a reason, whether we care about this or not. If you care a lot about consent, you would maybe think, oh, forget the automated device, just have it be an advisory device that doesn't make decisions on your behalf. And so that way you get consent at every step along the way. So the device asks you, do you consent to having this medicine dispersed in this moment, things like this. So yeah. As in the case with most new technology, which are being introduced to the people who will be responsible if things go south, talking about brain transplants, sure there will be clinical trials before even thinking about making it an option for people to pursue. However, who will be responsible if things don't pan out? Clearly the patient who is choosing to be the subject of a medical trial is not in his or her right mind because, well, it's a brain implantation. So I think in one sense, you could kind of be in your right mind, I think, for a lot of these brain implants. So if you just have epileptic seizures or obsessive compulsive disorder or the other sorts of things these brain implants might be treating, those don't compromise your decision-making capacities at all. Even some things that compromise your decision-making capacities a bit, like being overly aggressive or things like this, which are things that people talk about brain implants to treat, you might think those don't sort of fully compromise your decision-making capabilities, so you can still sort of decide whether to do it. And so those are reasons to put a lot of the responsibility on the person getting the implant. And then in general, I'm not sure if this question is sort of different than what we'd say about other sort of medical procedures. So, you know, who's responsible if you get surgery on your kidney? Well, you know, you to some extent because you consent to it. If the doctor screws up or doesn't inform you beforehand, then maybe the doctor also is responsible. Stuff like that. So I'm not sure brain implants, at least in many cases, present a special challenge to this. On page 5 of the article, the last paragraph suggests that perception of an increase or decrease in autonomy on using predictive and advisory implants is subjective, preventing us from reaching a concrete conclusion. So wouldn't it be convenient to generalize that the use of brain implants does not infringe on one's autonomy because its use is governed by the autonomy of the person in question? Isn't the person responsible for consenting to everything that their decision entails? Yeah, so this is similar to the earlier question, which is to one who has consented, no wrong has been done. And so the thought is, well, I mean, sure, you can consent to the original device, but if the device is automatic after that, then it's not asking you for consent when it's dispensing the medicine. And so we usually don't think it's sort of like fully consent if you can't back out of it later, even though it would make sense to let you back out of it later. So for instance, if I sign a contract that says, you know, I have to deliver 10 cases of peanuts to somebody on Tuesday, or else I'll have to pay a penalty. If you sort of force me to deliver the peanuts, you don't let me back out of the contract and pay the penalty. The thought is, well, that's sort of not really treating me as autonomous. That's not really listening to my consent or my withdrawal of consent. So the thought is, one weird thing about these brain implants is that if you consent to getting them at one time, that'll sort of override your consent in the future if they're automatic or things like this. And so the worry is that these are sort of, it's not as easy as something like liver surgery, where you consent on Monday to the liver surgery on Wednesday, and sort of your consent is all that we need. If you consent on Monday to an automatic brain implant that sort of gives you medicine on Wednesday, then we might think, oh, now it's starting to sort of override your decisions, because if you change your mind, now the brain implant is there and stuck. And so the thought is, we could make implants that are less overriding like this. We could make implants that don't dispense the medicine automatically. They just say, hey, you could use some medicine right now, and then it's up to you. And so the thought is, oh, this would be more consent, more autonomy. And so, or even no brain implants at all. Like maybe screwing with your brain screws up your autonomy, and so maybe the best would be no autonomy. And so that's the thought. So isn't the person responsible for consenting to everything that their decision entails? I mean, maybe, but if you really care about consent, if you really care about autonomy, it seems like maybe you want to avoid these implants, which will sort of reduce consent and reduce autonomy in the future. Or maybe you say, no, I don't care. They consent on Monday to get rid of their autonomy for the rest of their life. Go ahead with it. And some people do take very strong positions like that. On page 9 of the article, the first paragraph suggests that the patient's autonomy is preserved when he provides consent to the automatic predictive device that induces treatment, which the patient can't control. Earlier in the article, the author mentions that self-control leads to providing autonomy. Since the automatic therapeutic responses act continuously and don't allow control from the patient, wouldn't this affect the autonomy of the patient due to loss of self-control in taking the medicine? Yeah, so I mean, that's the suggestion I just gave. Like, lots of people have that sort of view, which is once they're autonomous, then once the device is autonomous, the patient loses autonomy. So once the device is automatic, they lose autonomy. So what I think Gilbert is talking about here on page 9 is, let's see. In terms of informed consent, initially patients agree to be implanted with an automatic predictive device. Their consent is not required every time the device induces treatment. Once the device is implanted, a patient about to suffer from an epileptic seizure will not have the power to stop the device from inducing treatment. In this regard, it would be difficult to see how a patient's sense of autonomy could be threatened. On the contrary, because the device operates continuously and delivers automatic therapeutic responses, a patient's sense of autonomy is preserved rather than compromised. So this is similar to the previous question about the subjective sense of autonomy. So the thought is, here we have a sense of autonomy being preserved, so people sort of feel in control even when they have this automatic device. And then I think this is a secondary article. One, at least, secondary article points out that we have sort of this idea of the sense of autonomy, and then we have the idea of autonomy. And so then the question is, are these the same thing, or are these separate things? And you can go in either direction on that. So some people say yes, some say no. And if you go in one direction and say the sense of autonomy is sort of the same as autonomy, then you have to sort of, like Gilbert is suggesting, check to see how the patient feels. And if they feel autonomous, then maybe they are autonomous, even though they have an automatic implant taking over their brain. On page 9, this is, yep. Starting page 6 and continuing to page 7, the author talks about what it's like to be implanted with a predictive and advisory brain implants, and discuss whether it hinders patient autonomy or not. However, throughout the course of the argument, he does not mention the degree or precision of advice the PBI will provide, the predictive brain implant. For example, a PBI can provide general advice to do P to prevent Q, or can it provide precise advice like take the medicine? But yeah, should this specification matter? Because in cases of very precise advice, the patient may almost be forced into doing what the PBI advises. Doesn't this threaten patient autonomy as well? Who gets to decide the specification? Good, yeah, so at least one of the secondary articles kind of mentions something like this, sort of the idea of the device giving you like one right answer. I think to some extent, like empirically, this is not a big deal. Like the devices they're talking about in these articles are sort of take the medicine or don't take the medicine, and then it's not like you have lots of options for the medicine. There's just one anti-seizure medicine or something. But the broad point is an important one, which is, well, does it matter how fine-grained the suggestions are if they're just suggestions, or does it not matter? And yeah, I don't think there's an easy answer here. You might say, I don't care about how specific or unspecific the suggestions are, as long as it's not forcing you to do anything, as long as it's not automatic, you still have full autonomy. The other sort of direction is, no, once it starts to like give you a list of things to do and like really specify what you ought to be doing, then it's almost like commanding you. It's not just suggesting, it's saying like, here's the one right thing that the brain implant knows you should do. And so that seems like it limits autonomy. You might have different understandings of autonomy, and different understandings of autonomy would say different things about the different cases, or the same thing about different cases. So yeah, no easy answer there. Good question. On page number 8, Gilbert talks about the issues regarding over-reliance and how it may lead to risky behavior as a patient becomes less cautious than without the advisory device. While I agree with the author's point about the patient becoming over-reliant on the devices, leading to certain unwanted consequences, I think risky behavior on the patient as one of those consequences is a bit of a stretch. Even with an advisory implant, how much risk can an individual suffering from a serious neurological disease take, so much that it may lead to iatrogenic harms? It may be wrong if even slight risk can lead to iatrogenic harms, but if that is the case, in my opinion, the author should provide examples of such risks by perhaps using the epilepsy case he has mentioned in the article. Yeah, so I think over-reliance, the harms of over-reliance are pretty simple to see if you just imagine that the implants are not perfect, and so the person starts to get used to relying on the implant to deal with whatever condition they have, and so they start to think that their condition is sort of at a certain level of severity, or maybe even the condition is basically gone because they're coping with it with the implant. But then at one point the implant doesn't sort of successfully predict something, and then their condition is sort of more harmful than they've been predicting that their condition would be, and then they sort of suffer the harmful effects, and then who knows what can happen then. And so I think as long as the implants are not absolutely perfect, this is going to be a potential worry sort of for any sort of situation. Now, it depends on how the implants are. So if we have perfect implants, maybe over-reliance is never going to be a problem, but, are we ever going to have perfect implants? On page 8, paragraph 2, the author mentions the fact that a predictive brain implant could put thousands of patients at increased risk of harm given that they feel secure, so similar sort of thing. My objection to this statement is that patients being overly restrictive is in some cases a necessity right now due to a lack of information or access to healthcare. This overprotective instinct may also cause them harm, since avoidance of regular experiences due to illness is also harmful. Moreover, a tool that empowers patients to return to a more regular form of life may not necessarily put them in danger, since it's flawed to assume that any option towards increasing their autonomy would also increase the risk, given overprotection is also harmful. I think there must be a middle ground that exists between overprotective harm and risk-taking harm that's at least both of these types. Yeah, so I'm not sure the author was... Paragraph 2, over-reliance and... Yeah, so I think the author, Gilbert, wasn't going so far as to say, don't use implants or anything like that. If Gilbert were going that far, I think this would be a good objection. I think Gilbert is just saying, here's like a worry about brain implants. So here's an potential ethical issue with brain implants. And I think if that's the point, then it sounds like you're even agreeing, because you're saying, look, there's a middle ground between overprotective and risk-taking harm. And Gilbert's point, I think, is that, well, we don't want to sort of just ignore the risk. We don't want to sort of maximize risk-taking. Sometimes we do want to be overprotective, or at least we want to think about whether to be overprotective. We at least want to ponder whether it makes sense to be a little more protective than we might otherwise be, because sometimes the implants can fail or something. So I think Gilbert is just saying, here's a sort of ethical point to keep in mind. We don't want to ignore this. And so that's a sort of limited conclusion, but like I've said in class a few times, for various reasons, like a lot of philosophy just doesn't, I mean, a lot of, all academia tries not to sort of go too far and say too much in one short article. With respect to postoperative effects, in the case of the patient that is not able to judge between their natural instinct and predictive implants, how ethical are such predictive brain implants? Yeah, so good sort of discussion question. There's certainly no like clear answer or right answer there. I'm not sure there's much to say on this question that isn't just sort of covered by the broad discussion that we're having and that the secondary articles are having and things like that, which is, well, how much do you value autonomy? What is autonomy? Is autonomy harmed by people not being able to sort of distinguish between their instincts and the predictive signals? If it is, how is it harmed? Does it matter that it's harmed? Things like this. I'm still wondering what the definition of autonomy is in the context of predictive advisory brain implants must be. In the example given at page 7 of an epileptic patient using predictive brain implants to prevent seizures, the very presence of an implant that controls drug delivery seems to take away autonomy in that you are not in control of your body. However, now that the seizures are no longer a hindrance to the progress of everyday life, the patient feels a lot more control over his life, which in a way seems to give autonomy. Thus, in this specific case, is autonomy enhanced or taken away? Yeah, so this is, I think it's a good sort of central puzzle that Gilbert raises in this article, which is, well, if your feeling of autonomy goes up, can your autonomy be going down? Do you have less control if you feel more in control? And epilepsy is a good example here, because sort of to feel in control is to sort of be able to avoid these seizures, but maybe you don't really have control if your sort of avoidance of seizures is being taken care of for you. So this is kind of, I think, like the central case for brain implants, which is when it comes to autonomy, which is if you feel more autonomous, are you more autonomous? There's not an easy answer to yes or no. Part of that depends on what autonomy is. I was talking about autonomy earlier as sort of self-control or self-law giving, being in control of yourself. But then another sort of popular sense of autonomy is sort of being able to do what you want to do. So being able to live how you want to live. Like, that's what autonomy is. And in that case, the brain implant, as long as it just gets you better results, seems to be increasing your autonomy. So if you take sort of that direction of autonomy, kind of like a more consequentialist kind of thing. It's not literally consequentialism, but it's sort of like, oh, I don't really care what's sort of going on in my head. I just want to get the right sort of outcomes. Like, I want to do what I want to do. I want to live how I want to live. That kind of autonomy can sort of say, yeah, brain implants aren't going to threaten that autonomy too much. They're just going to sort of help you live how you want to live. And so there you go. Some level of subconscious automation in voluntary action is required to keep the body functional, for example, beating of its heart. But we do not need to exercise control over it as long as it's doing its job. Is control still a valid determinant of autonomy if the desired outcome is achieved? Good. So that's exactly the sort of question we were just talking about, which is, look, as long as I get what I want, does this really impact my autonomy? And so I think, like, you might imagine somebody saying, humans would be more autonomous if we could control our heart and control our other autonomous functions. Like I shouldn't have said autonomous, but like the same word gets used for various things. So the heart is sort of autonomously functioning, but is that part of our autonomy? I don't know. So so that's one thing you could say, which is humans are less autonomous because we can't just stop our heart. We would be even more autonomous if we could stop and start our heart or control how fast it beats. So, your heart beats faster when you're doing vigorous exercising or when you're maybe scared or adrenaline or something. And so, maybe if you could control that rather than it just being up to your body, maybe that would make you more autonomous. So some people say that. And other people, again, the more outcome-focused people say, no, I don't care what's under control of my body. Like, I just want to do what I want to do. And as long as I have that, I'm autonomous. So a lot of people see autonomy as sort of not about getting results, but about making decisions. So the thought is, oh, autonomy is important not because it gets you what you want, but because sort of you're making the decisions. And maybe autonomy is important even if it doesn't get you what you want. So it's important to live your own life and make your own decisions, even if you get like bad outcomes. Why? Because at least you were in charge. At least you were autonomous. So that's one sort of strong understanding of autonomy. Then there's the other understanding of autonomy, which is no, you get what you want, and so who cares how it happens. So yeah, not an easy thing to sort out. Both understandings of autonomy have a lot to say for them. There's other things to say about autonomy, even sort of outside those two things, but I think those are the two sort of central understandings of autonomy that are kind of fighting when it comes to the brain implant, which is autonomy is getting what you want, living the life you want to live, and autonomy is sort of being in control and not being ruled by something outside of you. On page 8, the author makes the assertion that having predictive brain implants can lead to a sense of false security. My question is, if the whole reason for using these devices is to predict and sometimes advise implanted patients on neural events, then why should they not feel secure? The whole point of these devices in the first place is to make life easier, as seen on page 7, when a patient suffering from epilepsy clearly articulated how life had changed for the better. Yeah, good question. So I think, like, when I earlier brought up the idea of devices malfunctioning, I think that's the sense I at least got from Gilbert, is the main worry is that, look, as long as the device isn't perfect, over-reliance will give you a false sense of security rather than a true sense of security. If the devices were actually perfect, then this would not be a worry. Let's sort of see, let Let me just make sure. Over-reliance on invasive, false sense of security, continuously informed, proceeding while reliance, patient reported family mortalities. Yeah, so the only way to make sense, I think, of this paragraph about over-reliance and things like this is on the assumption that the devices are not perfect. They won't always predict something coming up, or maybe they'll falsely predict something coming up. I think if the devices were sort of absolutely perfect and they'll never sort of miss anything, then their harm wouldn't be sort of false security. There might be other harms of over-reliance, like maybe you lose autonomy just by letting the device do everything. But I think the false security risk has to be based on sort of imperfect devices. That at least is my view. I don't know if anybody in chat right now has other views or things, because I'm not sure the author sort of explicitly says this. Yeah, so the author just says, oh, it encourages people to behave in ways that they wouldn't behave otherwise. But like, yeah, the point is that you're supposed to behave in ways you wouldn't behave otherwise. So that can't just be the worry. It's got to be something more than that. And so that's why I'm suggesting, oh, it's because you behave in ways you wouldn't otherwise. And then the device screws up and then you get in trouble. So the GPS device leads you to drive down a road you don't know yourself, but then the GPS got it wrong, and so you don't get where you're going, and now you're lost. So now that's a problem. With respect to seizure medication and its automated consumption, if the informed consent of the consumer and active autonomy results in taking away one's autonomy, will said action all resulting still be? Yeah, so we saw this earlier, this question. Well, one of the other questions, which is once someone's consented, there's no harm, things like this. And so, yeah, we've talked about this a lot already, so I'm not sure there's more to say, except that this is like one of the weird puzzles of autonomy. Can you autonomously, right now, get rid of your autonomy in the future? Or does it still count as autonomy in the future because you sort of got rid of it earlier? I think often, so I think the most popular view of people is that, look, if you make an autonomous choice right now to get rid of your autonomy in the future, that sort of makes you less autonomous. So imagine I take a drug right now that's going to render me sort of brain dead for the next 10 years. I think we would think this is kind of reducing my autonomy. True, I autonomously took the drug, but then that sort of destroyed lots and lots of future autonomy. So we might think, look, in terms of measuring autonomy, I actually ended up less autonomous overall. I made one autonomous choice, so that's sort of in the plus direction, the choice to take the drug. But then I got a lot of minus autonomy for not being autonomous in the future. That's the sort of worry about brain implants, which is you have a lot of autonomy over whether to get the implant, but if they're automated, then it seems like a big minus for autonomy in the future. Gilbert argues that predictive implants threaten autonomy because the implanted individuals have no control over predictions in the device produced by the devices. My question is, why does the implanted person require autonomy in decision making, as long as the predictions in the device produced by these devices will help him or her control the symptoms and therefore improve quality of life? Yeah, so you could say, I don't even care about autonomy. Oh, sorry, so we have a thing in chat. Yeah, so backing up. So are we basing on the fact that these devices are not perfect? Yeah, so my suggestion for your question earlier, which is this false sense of security, the only way that worry makes sense to me, the only way I could have sort of a false sense of security is if the device is not perfect. That's what sort of makes the sense of security false. If the device were perfect, it predicted absolutely everything and it always knew how much medicine to take or to give me or whatever, then it seems like that would just be a true sense of security. So I would feel secure because I am secure. So I think the assumption Gilbert is making is that the devices will not be perfect. I think that's the only reason it strikes me as a false sense of security. That at least is my reading of sort of what Gilbert is saying. Yeah, so this question, why care about autonomy if it improves the quality of life? So that's the sort of most extreme, I mean, there's probably even more extremes, but that's kind of the most extreme answer, which is just forget all this autonomy stuff, just make people's lives better. The challenge here, I mean, there's lots of challenges here. One is that if you like, how do you measure a better life? If a better life is just sort of more happiness or more pleasure or something, then you sort of worry about having a dystopian sort of future where we like everybody gets implanted with a brain device that just makes them sort of as happy as they can be all the time. The book Brave New World is kind of about this. It's not brain devices, but it's drugs that they take. People just sort of give everybody drugs to make them happy, forget about their autonomy, things like this. And so one worry about autonomy, like just getting rid of it in favor of quality of life, is that, oh, that seems like it could have bad results, kind of, if you push it to the extreme. Another worry is that sort of just for practical purposes, letting people, like getting people the best quality of life. Well, how do you get people the best quality of life? Like who decides what counts as quality of life or whatever? It turns out that sort of putting people in charge of their own quality of life, you might think often turns out better. So this is the sort of thought behind like democracy, for instance. Like why have democracy? Why not just have like very smart, kind dictator in charge? Well, the thought is like, it doesn't matter how smart or how kind you are, how hard you try. It's going to be sort of tough to do what needs to be done without sort of like, it doesn't matter how much information you have, people are always going to be better at looking out for themselves than they are just having somebody else rule them. And so the same reason you have democracy, which is like let the people rule themselves, let people make their own decisions, is the same reason you sort of give autonomy to individuals, which is, oh, if you put me in charge of how my life goes, I'm going to sort of try to do my best, and it's not always going to be perfect, but I'm at least hopefully not going to screw up too badly. Sometimes people do screw up very badly, so maybe you get addicted to heroin or something, and it turns out very bad. But the thought is, well, if we want things to go best for people, maybe often we kind of leave it up to them. So that's the sort of one argument underlying this sort of thing, which is, well, why do we care about autonomy? Which is, well, maybe it's very hard to just like make people's lives go better if we're in charge of their lives. We just don't know enough about them. We don't know what sorts of things they like. We don't know what kind of person they are. We don't know what the future holds for them. So maybe the best we can do is leave it up to them. On page 7, Gilbert summarizes that while implants provide better degree of control to patients, thus increasing autonomy, they also place a certain degree of control on said patients, effectively diminishing autonomy. And the main reason he provides for this is over-reliance. But in any case, when compared to the default case, aka a patient with certain symptoms, using an implant can only mean increase in the autonomy provided to one, because the problem of over-reliance is one considered on the basis of said patient with symptoms leading a normal life after the effects of the implant, when the basis should be the patient leading the life that is appropriate considering their symptoms. Therefore, won't using implants only ever have an increase in autonomy, or at the very least not lead to a diminishing? Yeah, so I think the idea is supposed to be, it's not that you have less autonomy sort of overall at the end, it's just that you have an increase in autonomy because of decrease in symptoms, but you also have a decrease from the fact that you have this automated thing in your head. So I think my impression is the worry that Gilbert is raising isn't that you end up with less autonomy overall. It's just that, number one, here's a minus on autonomy. Here's a negative impact on autonomy, these implants. There might be ways of designing implants that have a bigger or smaller impact on autonomy. So maybe automated implants have the most impact and less automated implants have less impact. So number one, here's a threat to autonomy. Number two, the threat can be adjusted depending on how the implants work. And then number three, if you sort of care about autonomy, if you say like, I just want whatever gets me the most autonomy, this might like depend on a patient by patient basis. The cases might differ. We have to sort of look at these sort of things. We can't just ignore the thing, is I think what Gilbert's point is. So I'm not sure Gilbert means to say necessarily that you'll never have more autonomy with the implant. I think he's just saying, look, let's worry about it. This might affect the design of implants. We might want implants designed in a certain way for autonomy, things like this. What do you feel about the argument that since we don't have any free will to begin with, we're overwhelmingly algorithmic beings that are controlled by our genes and environment, predictive implants actually provide us with more free will, as they allow us to tap into the process that are otherwise going on outside our control, as they're outside our awareness, and so by giving us knowledge, predictive implants are in fact giving us more autonomy than we ordinarily possess from birth. Yeah, so There's a lot of complications here. One is that if we really don't have any free will, if we're just driven by algorithms and our genes and the environment, then you can't fix that with an implant, because either like, who is the implant gonna, like, so let's say the implant just gives you advice. It's not automatic in terms of giving the medicine. It just says, hey, it would be a good idea to take some medicine right now because there's an epileptic fit coming up in a few minutes. Then the thought is, oh, now I have the choice. Now I have more free will. But if we accept the initial premise, if we accept the idea we don't have any free will to begin with because we're just controlled by our genes and our environment, then when I'm sitting here deciding, oh, do I take the medicine? The implant tells me to take the medicine. Should I take it or not? Well, is that going to be a free choice? No, it's controlled by my genes and my environment. So if it's true that before the implant, I was controlled by my genes and my environment, then the implant can't change that just by giving me advice. I'm like, do I listen to the advice or not? Well, that's controlled by my genes or my environment. That's one sort of thought. Now imagine the implant is automatic. It just dispenses the medicine automatically. Now, again, I'm still being controlled by my genes and my environment and now my implant. Does this give me more free will? I mean, not if I didn't have any in the first place. This changes a bit if you think, no, we do have free will. We do have some autonomy. So here's an important point. We often use autonomy and free will sort of to mean the same thing. So you have more free will if you have more autonomy. You have less free will if you have less autonomy. So if you think we do have autonomy in the first place, then this question sort of makes more sense, because then there's some hope for the implant giving us more or less autonomy. And then so the question is, well, the implant gives you knowledge and now you have more free will. I mean, yeah, I mean, that's the sort of pro-implant autonomy argument, the pro-autonomy implant argument. I'm not sure which direction makes sense, but the thought is, yes, they increase autonomy because they give you information and you make the decision with the information, and so you're good to go. That, at least, is for the implants that just give you advice. It's not for the implants that give you the medicine automatically, because they don't give you information, they give you medicine. So you might think, here's a difference between these two implants. And so this is an interesting ethical point, which we've now learned. If I care about autonomy, ethically speaking, the advice implants are better than the automatic implants. So whether that makes sense or not, that at least is, I mean, that seems to be the direction Gilbert is kind of leaning, if anything. So that's a sort of argument based on autonomy for a certain kind of implant and against another kind of implant. So that's interesting. So I think, is that all the questions? Yeah, that's all the questions. So this has been a fairly long session, 45 minutes. So I think to keep this video from going longer, I'll stop here, but maybe I'll answer the other questions at some point in the future. So if you've been watching live, thank you for tuning in. If you're watching this on YouTube later, thanks for watching. And of course, if you ever have more questions, you can ask in future videos or on the discussion board. So goodbye.